It's a probe from my man, Charlie Peters, about the exploitation watchdog, who has basically reported a surge, a tenfold surge, over the last few years of forced labour. So in 2021, there were just 4 investigations by the Gangmasters and Labour Abuse Authority, while in 2023, last year, there was 44. So what's causing this sudden increase? Charlie Peters joins us now. Charlie, great story and shocking statistics as well. Just give us some context about what you found and, the reason behind it.
Well, most of the researchers and analysts I've spoken to about this sudden surge in these investigations by the Labour Abuse Authority have said that there is a link between the health and care visa route that has seen a very significant surge in recent years. When it was first introduced, the Department of Health anticipated around 6,000 people would take it on, about 0.3% of the total NHS and social care workforce. Last year, 350,000 people arrived on that route. Since January 2021, when the Brexit transition period ended, 570,000 people have arrived on this route. 99% of them are non-EU nationals. And at the same time, there has been a significant criticism of that route and some of the changes in the care sector in recent years. There was a report leaked from the Home Office, earlier this year by David Neal, the former Chief Inspector of the Borders, who found in one case there had been 275 visas issued to a care home that didn't even exist. So with those significant numbers and all these concerning situations, it's no surprise, perhaps, that the Gangmasters and Labour Abuse Authority is now confirming to us through a Freedom of Information request that they've seen that tenfold surge in probes into the care sector.
And what is the care sector saying about this?
Well, there's been quite limited commentary from individual companies. When we asked for further information on the specifics of their investigations, they said it would be too difficult to manually source them. It would breach the cost limits. A government spokesperson told me that they are concerned about abuse of particularly foreign migrant workers in the care sector, and that they've introduced rules in England specifically to not allow visas to be issued unless they are conducting regulated work in the Care Quality Commission. So unless they're being regulated by that authority, that can't be pursued. Also, we've seen over half of those coming on this visa, this health and care visa, are dependents. So that's also been a cause for concern. The government's acted on that earlier this year by reducing that path for dependents. But Unseen UK, which is a modern slavery helpline and charity, yesterday they reported a 30% increase of potential victims calling them from this sector. Really stunningly, that comes on the back of a 606% rise on the year before. So this concern is still growing at the same time as the Labour Abuse Authority is looking into this sector.
So these workers, they're potentially working very long hours, awful conditions. Bad pay. How are families of people in care homes, elderly relatives, parents, how worried should they be about the standard of care they're receiving when the workers themselves are being abused like this?
Well, the Tory MP, Neil O'Brien, told me that this visa route has been a boon for criminals and exploiters. And not only is it extremely dangerous for many of the people coming in on this route who are then experiencing terrible conditions in care homes from their employers, as you say, Ben, it's also really concerning for those who have family members in the care sector who are concerned potentially that the quality of the care they're receiving is reducing. There were 0 investigations by the Gangmasters and Labour Abuse Authority in 2020. To then surge up to 44 last year does suggest that almost certainly has been a sector-wide decline in standards as they adapt to hundreds of thousands of new workers and dependents arriving on that route. So it's a sort of a double-edged sword in terms of a decline in standards, both for workers and for those on care.
OK, Charlie Peters, great story. Thank you very much.